Thank you. Thank you all so much. So I'm going to talk to you today about our lived experience of taking an organization that was focused just on the US to becoming an international organization. So there's lots of limitations and struggles when thinking about going global and creating international connections. You've got the understanding that there could already be quite a lot of fragmentation, and that could be both within the health professional world, but it can also be, and sometimes even more so, in the patient community as well. There's often a lot of different patient organizations, some kind of kitchen table startups, others that are legally registered as non-profits, and all of them are usually driven by their own personal narrative and experience, and that can often come with a lot of frustration, a lot of pain, and lived health experiences. So you have to be very mindful of that when working through trying to connect all these different people, and remembering how different the cultures can be, language can be, how you market to those people, and how differently people receive things. So I think when we were thinking about turning our organization to be truly international, I think fragmentation was our first hurdle. And I think there's no real one way of overcoming that. I think it's time, I think it's trust. And I think you need to try and show everybody that there is enough space for everybody to be around the table. And as much as there could be one organization that is driving that, it needs to be with everyone putting their thoughts, opinions, and experiences together. And I think that is something we're still working on, to be honest, especially from the patient community. I feel like we've really got to a very good place with it with our health professionals, and I will speak a little bit later about some experiences and examples of that. But it is something to certainly consider, and to not expect that just because there is something there in place that answers all these questions and needs there were, that it will be automatically well received. I think the other struggle that many people can relate to is the budget to make this happen. So when you're thinking about becoming international, you have to think about making sure that all of your programs, all of your resources, all of your content speak to a global audience. So instantly we realized that our website was very US-centric. My experience had been running the UK organization for 5 years, so I came from a very UK focused experience, and we really needed to get lots of different inputs in to make sure we were getting it right. And instantly, even just that UK and US perspective was so different when it came to thinking about marketing and advertising and social media. And that, of course, comes with a budget. And so when it came to really taking our website to a next level, it also came with translating our materials into between 7 and 12 different languages, depending on our events. It's a huge cost to do that. A lot of the time you can rely on Google Translate for program work like events, but when it comes to health information and recommendations and guidelines, if you get something wrong, there's a tremendous amount of responsibility in that. So we have used an organization to help with our translations, but I think what's key, whichever way you go down, because we also get a lot of volunteers that approach us to help with it, and it goes back to the same thing, there has to be accountability. So we disclaim everything. So, for example, a lived experience, the coronavirus that we're all dealing with at the moment, we have translated all of our materials for our upcoming European Learning Conference that's going to be held in Paris. And we had translated everything into 7 different languages, all our registration forms, all the event information. We had live translators that would be coming into the room. And, of course, we've had to postpone it because it's in 3 weeks' time, and, you know, everyone is quite rightly very concerned. And so we had to turn around things very, very quickly. And we did actually use the help of some volunteers versus going down the road of the company we used, because their turnaround to do something in 24 hours was tremendously expensive, and we did not have a budget for it. But we were just very sure that we disclaimed it, saying this has been translated by volunteers. We apologize in advance if there's any errors. And so people realize that there are going to be some mistakes because it's a non-profit and you're just trying to do your best. So whether you go through an organization, whether you go through volunteers, whether you go through, you know, using colleagues within the organization, as long as you disclaimer everything you've done, so you're covering yourself, that will help. So translations is a huge thing to factor into budget. And your program work. So when we were doing an annual conference, and we call it our Global Learning Conference, but it was in America every year. So is that truly global? No. So we've now changed that to being our US conference, and every year in addition to that, we do a rolling global conference. And in just a few years, we've been to India, Brazil, America, Australia, Europe, and with every single one that we're doing, we're now started from last summer, we are live streaming that so that you are again reaching people that can't afford to get to a conference in person, or geographically might not be able to reach it. So you're instantly reaching a more global audience by offering that live stream capability. But that comes at a huge, huge budget. And so you have to consider all of these things. And so it's not just enough to say you're a global organization if you haven't thought about these ways and means to make yourself truly global. And of course, those in-person events and meetings and growing your audience is essential. With all of that comes capacity, staff capacity. When we launched our organization in May 2016, we had 2 people, one full-time, one part-time. And just a few years later, we've just hired our 20th member of staff. And we need more, we just don't have the budget in place for that. But what we realized very quickly is all of this program work and all of this global reach comes with huge capacity needs. And so it kind of is a domino effect. You've got to have that budget to be able to have the capacity to be able to deliver these things that truly do make your actions and words marry each other, so you are having that global stretch and reach. And time, everything takes a really long time. Putting on more than one event, putting on even one event a year is hugely time consuming. Having the translations done, having a social media and communications team that can think about what different posts do we need to do that will target a different audience and community. What may work in Brazil may not work in Israel, and what works in Israel may not work in Dubai, and so on. And we know we have patients living all over the world. The reality is most of them are still in the US and Europe, but we're slowly over time, and that's really been only in the last 12 to 18 months, starting to see 1 or 2 people in the Middle East, in Africa, in India, in Asia. And what we see is that spike increases after we've been there in person. So for one example, in 2018, in December, we did our first conference in Australia, and we had a huge increase in the amount of health professionals on our health directory and in patients on our registry and on our social media. So it really does make a difference being there in person. But that kind of decision making comes with a big thought on budget, capacity, and time. And so I wanted to talk through a little bit more about our experience at the Ehlers-Danlos Society and showing you a little bit of a timeline of what is possible. And it is, quite a unique example because we have had a tremendous amount of growth in a very short space of time. But I hope it also gives people the hope that anything is possible. So I ran EDS UK, which is the UK organization from 2010 to 2015. And so while I was there in 2012, I attended what was the first concept of an international consortium, which was introduced there by the team. And that was bringing together health professionals and patient organizations from all over the world. In reality, most of the patient organizations, again, were just Europe and the Europe and the US. And the health professionals did have a global representation, but it was about 100 people that were in attendance. And there were great conversations and great discussions. But at the end of it, there was no overarching organization that was there and able to then take that conversation on to make it a reality. At the time, we had EDS UK that I was working for, and there was EDNF, which was the US organization. And so both of us were trying to work really hard to fill this global need, but we all had our national priorities and budgets and limitations, and it really felt like doing that national work had a real ceiling to it. And it was like putting what you guys call a Band-Aid over this wound that was never really being truly healed. And so really what I thought was needed, and many others were in agreement, was this need for a global organization to start to heal that wound instead of just putting that Band-Aid on top. And so in 2015, when I left EDS UK, we started conversations with EDNF about starting this global organization with their support financially and in terms of capacity as well. And we spent from 2015 to 2016 working with health professionals and working with EDNF to work out the best way that this could look. We realized very quickly that the reality is that we would be going to very similar donors and we would have a very similar audience as the US organization. So we decided instead that we would relaunch from EDNF as the Ehlers-Danlos Society, and that would be the global organization. So we had the benefit of having the audience that was already there from EDNF, albeit only the USA. The board in place, who were very focused on delivering this global mission. And I then came on board to be the co-executive director with who was then the executive director of EDNF, and together it was us two that launched the Ehlers-Danlos Society. And so it was a very, very brave, bold decision from the board of EDNF, and one I'm grateful for every day, because it was a real risk, and there was a huge financial risk in that decision as well. And that first year, 2016 to 2017, we thought we were finally answering what everyone needed and wanted. And we were very confused why the donations didn't just come rushing in. And it was a quiet, hard year. We had these huge aims and ambitions. We had launched in parallel with the society, we had formally launched the International Consortium for EDS and HSD. And that consortium is basically bringing together approximately 150 health professionals together, divided into all the different comorbidities that affect EDS and HSD and all the different types of EDS. And within each group, there is a patient expert as well, because it was very, very important to us from the offset to have the patient voice represented as equal stakeholders throughout all the work we did. So that came together, and that in itself is hugely unique, and everyone doing it as a volunteer in their own time, conference calls in the middle of the night, early in the morning, at the weekend, to work towards what was then published in March 2017 as the first reclassification of EDS that had ever been since 1997. There was 20 years there of huge neglect, and this huge upsurge of work from our global community, health professional community coming together, really started things moving quite quickly. Because we were giving evidence of this work that we were doing, people could see where their money could go and what those donations could go towards. And we were thinking about big research studies that we could do. We wanted to build a global registry. And slowly but surely, these big donations started coming in. In the space of a year and a half, we had 3 individual $1 million donations from individual donors, which is incredible. And for us, life-changing for the organization. When you think of other organizations in cancer or heart disease, that's, could be a morning of donations. But for us, this has never been seen before in EDS or HSD. So it really enabled us to take things to the next level, start to take on more staff, start to think about restructuring our website and making all of those decisions that would enable us to not just the rhetoric of being global, but truly being global. And I think now, looking back, that was our real limitation between 2016 and 2017. We had a really great talk, but we weren't walking the walk, and our work was still very US-centric. And when we really started putting out there and showing that we really did commit to being global, that's when we really started having that reach and that success. And so we launched our global registry in the summer of 2018. And again, we attached to that a research study that is looking for the genetic causes behind hypermobile EDS. And to this day, we have just over 9,000 people from all over the world in that registry. And only now are we about to translate that registry into our 7 different languages. So that hasn't been done from the offset, but there was always the want to do it and make that possible for everyone. So I do think that it is very important to have that in place, even though you might not be doing it as a reality. Showing your community that it's in your mission and your plan can be very effective. We then had another symposium at the end of 2018 in Ghent, and again, we strategically thought about where that could be, so it wasn't just the US again. And we liked the fact that it went back to Ghent, where kind of things all began globally back in 2012. And we have our next symposium planned in 2021, and we are committed to doing an international symposium for our health professionals every 3 years. And the health professional community have never had that support and that infrastructure in place that they can turn to, and I think that's key. I think it's very, very important to think about all the laws and regulations of data sharing, patient privacy. When thinking about a global registry, this was all new to us. We had to think about HIPAA, we had to think about GDPR, and these are real considerations. And of course, legal consult it comes at a price, making sure you've done that within the US and the UK, and things about laws and regulations as well of where you set up and establish in terms of receiving donations. So very early on, we made the decision that we needed to be registered in the UK as well as the US, because we had donors that wanted to donate in the UK and they couldn't benefit from gift aid. So it's important to think about that. And we do have in our mission and our plan to start to think about registering in other places in the EU because of Brexit, and in Canada as well. So thinking about the laws, regulations, bylaws, non-profit status, that again doesn't show you in just one country. So we have 2 addresses in the UK and the US, phone numbers. We've also introduced a global free phone helpline, which is free in about 70 different countries. And again, just putting that forward that wherever you are in the world, we will be able to support you. And that international consortium is what enabled us to collaborate with researchers internationally. We have people now able to turn to an organization that's offering funding for research, that's offering a place for people to communicate, and it's so desperately wanted and needed by the scientific community. So establishing that as a home, we don't control the content of what happens in the consortium. It's an independent group, but we facilitate them being able to communicate and talk together. So we put the conference calls in place, we record the minutes, we take the minutes, we disseminate those, we make sure that they're having monthly calls. What they discuss and what the outcomes are, that's independent. That shouldn't be driven by the nonprofit. That needs to be driven by the health professional community. So again, really being clear of what the mission of each group is very, very important from the offset. Another global platform that we're using is something called Project ECHO. Project ECHO was first started in New Mexico for hepatitis C. The idea was that there were very, very few experts that were looking after that condition. People were dying, people were traveling all over the country to reach this one expert who self-confessed that he was never a hepatitis C expert. He just happened to focus on that and educate himself. And that really resonated with us because there's no such thing as an EDS expert. It could be a gastroenterologist, a neurologist, a geneticist, a rheumatologist who just happen to be willing to educate themselves and get experience in treating patients with EDS. And so we launched in 2019, the beginning of 2019, EDS ECHO, which is a all-teach, all-learn virtual education platform. If you think of it as almost a virtual ward round, so professionals from all over the world dial in. We have about 7 different programs running now in vascular EDS, for example, allied health, general EDS and HSD. We're about to launch in pediatrics, in orthopedic, in the rarer types. And professionals dial up from all over the world for free. They can claim CME credits and they can present de-identified case studies to then hear from experts on the best way to manage that patient. And then there is a didactic presented as well. And this again has really allowed us virtually to expand our global network. And Project ECHO is a non-profit themselves and is incredible for rare diseases. And I can't recommend them enough. I really would suggest everyone reaches out to them. We have a budget in place because we have staff to help with the capacity of that, because we've gone kind of big. We were the first ever rare disease ECHO. We were the first truly international one from a non-profit. We have them running in Australia, in America, in Europe. And so we've been quite pioneering with how we use the Project ECHO platform. But it doesn't have to come at a high cost. And as I said, all the materials and everything to do with Project ECHO, other than their immersion that they ask you to go on, is free. So please do look into that, Project ECHO in New Mexico. And this model was so successful that we thought we really want to expand how we use this, and again kind of trailblaze how ECHO is used by launching a patient advocacy EDS ECHO. And so as much as we're trying to build up our army of health professionals, it's also just as important for us to build an army of patient advocates. Wouldn't it be wonderful to have a place where you can train patients to all be saying the same thing, using the right terminology, knowing how to fundraise, how to raise awareness, giving PowerPoints and tools and resources, so that if you're teaching a group of physiotherapists in China or Germany or Chicago, you're using that same content so that the correct information. There's been such bad misinformation about EDS that we're really committed to getting that correct information out there. And again, thinking about the need to translate those materials And that has been incredible. We launched that the end of last year, and we had 400 people apply for it with only 40 spaces on each cohort. So a resounding success, and Project Echo are very, very excited to see how the platform can be used in other ways. And so do look into that and think about those kind of tools that can help you expand your global networks. You need to think about the pros and cons of different ways to structure your organization whilst you grow. So the International Consortium is one example I gave of a structure within our organization of how we bring our health professionals together. But then again, I've mentioned a few times how important the patient voice is to us. So we have something as well called a comorbidity coalition. And we applied for a grant from BCORI to bring together other patient organizations, patient experts, and health professionals to all focus on the comorbidities of EDS and HSD. And that's been tremendously successful. We've identified patient-centered outcome research. We're working on resources, pathways, and guidelines. And that was a way that we could get funding in and to enable us to, again, have that global impact. But using volunteers from around the world, but thinking about ways you can do that virtually. And again, just thinking about the structures needed to ensure translations there, because it's all very well and good having all of your resources saying how international you are, but if that's in only one English language, then you're not fulfilling your mission. And recognizing that there is no one formula to grow. So you can see very clearly that our branding is zebra, you know, and it's important to remember that no zebra has the same stripes, but when you see a zebra, you know it's a zebra. And so you need to adapt for the needs of each community. For those of you that may be listening, you could think that would be fantastic for our community. And for other people, you could say, you know what, that just would not work. Every community is different. Every country is different where it starts from. You know, you could be doing a global organization that starts from and has, you know, got the most of the staff in, you know, in, again, the Middle East or Asia, and that might be approached very differently. So realizing that there are great tips out there and great ideas, but you need to know that there is not just one formula to grow and to be global. But there are some key factors that I hope I've gone through today that can help you ensure that it's not just words that are showing that you're global, and it really is in your actions, your programs, your mission, your events, that you are showing that as well. And one last thing that I think has been fantastic is we, as I mentioned, we went from 2 staff to 20, and all of our staff are completely virtual. We have no fixed offices, which has enabled us to take on staff from all over the world. Twice a year, we bring our staff together for what we call a staff retreat. That concept and word is very American. Retreat, when I heard that, I thought spas and massages, and very quickly realized could not be more opposite of that, because it is an intensive week of non-stop work and strategical planning. And we have a board retreat every year, and we have 2 staff retreats. But that budget is so much lower to do that than it is to have bricks and mortar office every day of the year, and to then be limited geographically as to who you can hire. We have staff from Belgium, around Europe, around America, and you know, we hope as we continue to grow, we can have staff from elsewhere. We have certainly volunteers from everywhere. But again, thinking about how you structure your organization, you don't have to think about an office and just hiring from where you are. Think about how your team can be global as well. Those different cultures and experiences and opinions will really enrich how global you really are. And I think it's been incredible to see when we have, every week we have a Zoom staff call, and you know, we've got tiny little squares of everyone's faces, and that picture keeps growing as we grow. And you know, you watch some of the UK people's faces when the US team might suggest a marketing tactic, and it's like, oh my God, no, that would never work, and vice versa. And having that there is so essential to ensuring we're representing that international message. So that's all I have today. Here's my contact details for both myself individually and our organization. And I would encourage you to reach out to me at any time for more of my experience of how we've done this. I'm incredibly proud of what we've done. We've come a very, very long way in a short space of time. We've gone from the kitchen table startup to a multi-million-dollar organization with large staff and big dreams and a really important mission. And I hope we continue to keep growing globally in the same direction as we have been, But what I think is essential for us at this point is working out how we maintain our growth, how we are sustainable. And I think we're one example of how you can kind of boom very, very quickly, but you don't want to then bust. So you need to, once you do grow and when you are fulfilling your objective, you need to ensure that you have the sustainability, the longevity, the plans in place, the resources, and the processes. One thing that we've learned through experiences is processes is key, and often you're just working to the minute every day and you forget the process, and it can really bite you in the end. So during that growth and during that global growth, you need to ensure that you have everything in place to keep you sustainable, because that is what is essential in this non-profit world, especially in the rare disease space. Thank you.